Hello and welcome to this session. My name's Alison Young and I'm the President-elect of the IEPA. Just a reminder to use the chat function, which is underneath the live stream if you want to connect with anybody or make some comments. If you're using the socials, please use hashtag IEPA virtual 2021 or actually it's hashtag IEPA 2021 virtual. Sorry about that. And if you want to ask a question, please use the Ask a Question green button that you'll see underneath the live stream. It's my very great pleasure to introduce this plenary number 6, our keynote speaker, Cheryl Corcoran, who is my friend and colleague of many years. Cheryl is Associate Professor and a psychiatrist. She's an expert in psychosis risk. She's working at ICANN School of Medicine at Mount Sinai, and she's a Harvard graduate with a master's in biostatistics. So please make Cheryl very welcome. She's going to be talking about computational phenotyping and psychosis risk using language, speech, and face expression. Thank you.
Hi, my name is Cheryl Corcoran, and I am going to speak to you today about computational phenotyping in psychosis risk, including language, speech acoustics, as well as face expression. I would like to thank the conference organizers for inviting me to speak and for all of you for listening. I'm from the ICANN School of Medicine at Mount Sinai in New York, where we have a psychosis risk program coping with unique experiences. So Steven Pinker said that language is a window into the mind. And if you think about what we do as clinicians and as researchers in terms of understanding the people that we are fortunate to meet and work with and to evaluate, much of what we understand about individuals comes from what they say and how they say it. It's the primary source of data for diagnosis. It's really what people tell us their experience is. They endorse symptoms through language. We also see some signs in terms of language, whether people are organized or not in the way that they speak. And language also is a device for treating individuals. If you think about what psychotherapy is, it's really a communication between two individuals. So we use language also for the treatment of mental disorders. So language actually is very easy and inexpensive to capture and to transcribe. It requires only a microphone and a recording device. You could use smartphone, tablets, laptops. And language really is big data at the level of the individual. So much of the world is using artificial intelligence and automated approaches, natural language processing, et cetera, to understand behavior, including speech and language and also face expression. And so our thought has been, and many of our colleagues as well, to use that same kind of approach of artificial intelligence to really understand language patterns in the patients that we meet and that we treat. One could study language in many different diagnoses. It is particularly useful to study in psychosis because it is not just a matter of content, what people are saying in psychosis that matters, but how they say it, the coherence of what they say, the complexity of their speech as well. So language production in psychosis has a long history. Nancy Andreasen really operationalized what doctors and clinicians had observed in individuals with psychosis in terms of the disturbances that they had. And she has a measure called the Thought, Language, and Communication Scale, which we use even today. And the heuristic that she derived included both positive thought disorder, which is sort of being tangential, having derailment, going off track, what's analogous to a decrease in coherence in speech, as well as negative thought disorder, which is a poverty of speech, poverty of content in speech. She noted that this was more specific to schizophrenia versus mood disorders, in particular bipolar disorder, this sort of poverty of speech and its content. And it can be considered to be analogous to a decrease in complexity of speech. And what Dr. Andreasen did, which is she would have a open-ended interview in which patients were invited to speak without interruption for 10 minutes, then were asked about personal matters and the abstract, personal being sort of how was your day, what have you been up to? And the goal, as she articulated it, was to observe a patient's speech and language behavior without complicated experimental procedures and without any attempt to characterize the underlying cognitive processes. And this is an approach that we also take in respect to natural language processing, really the analysis of language that is part of natural communication. I mentioned here Natalia Mota and speech graphs that she has because I think that some of her work in doing speech graph analysis as applied to language of individuals who have schizophrenia and who have bipolar disorder as opposed to individuals who are healthy volunteers, is that you can see this sort of complexity and coherence disturbances. So here in schizophrenia, you can see, as opposed to bipolar disorder and healthy individuals, that there's a relative sparsity of speech, which is not the case with bipolar disorder, and this was mania. And in this case, individuals have perhaps less coherence. And this is a speech graph where each node is a word, and you see the arrow speech is temporal, and this is a sort of sequence of people speaking. So these metric of coherence and complexity is assessed using Nancy Andreasen's thought and language communication scale, was used very profitably by Diane Gooding. What she did was she rated positive and negative thought disorder in transcripts from interviews taken with children who had participated in the New York High Risk Project in New York City. The New York High Risk Project included 264 offspring of individuals who either had schizophrenia, affective disorder, or no diagnosis. These were semi-structured interviews. They were about 8 to 10 minutes long. They were obtained when children were, on the average, age 10, plus or minus 2 years. And of these 264 individuals, 23 later developed psychosis. And what Diane found was that these thought language communication ratings were predictive of outcome 8 years later with an impressive accuracy of 94%. And so the decreases in coherence and complexity, what Andreasen operationalized as positive and negative thought disorder, were predictive of who developed psychosis, in particular schizophrenia, and the negative thought disorder with this poverty of content and poverty in speech added to the prediction of schizophrenia specifically. So this is very promising and raises the question whether coherence and complexity could be measured beyond sort of clinical ratings of what was observed. And so the next studies, manual linguistic analyses of speech, and that's Carrie Bearden on the left, who was the author of this manuscript. This was a study not in familial risk, in which individuals had a parent with an illness, but these are individuals who are clinical high risk, who have attenuated or subthreshold psychotic symptoms. And in her study, she had the clinical high-risk adolescents, mostly adolescents, do a paradigm called, developed by Rochelle Kaplan, called the story game. And in the story game, individuals would recount a story heard and answer questions about it. In addition, they would tell a new story. And there were research assistants who were trained in the Kitty Formal Thought Disorder Rating Scale. So a little bit like the TLC in terms of rating thought disorder, but perhaps a little more operationalized. And so you see here conceptualizations of and examples of illogical thinking. So for illogical thinking, an example would be, I went to school today because my name is Tom, which is not logical and it's kind of analogous to not quite being coherent. And also for poverty of content, here is an example, maybe, well, yes, I see, I suppose, that's all. You can see there's not a great deal of content being articulated here. Like the TLC, this Kitty Formal Thought Disorder Rating Scale was pretty labor intensive. She had a large cohort of 51 healthy individuals and 54 individuals at clinical high risk for psychosis who were followed prospectively for transition or conversion to psychosis, among whom 21 actually developed psychosis. This algorithm, was obtained, this paradigm was done at baseline. So it was examined as a predictor of who developed psychosis or not. And what Carrie found was that illogical thinking was highly predictive of who among the clinical high-risk patients would develop psychosis, as was poverty of content. So this, again, like what Diane Gooding had done, showed that elements of language, when clinically rated, that loosely kind of map onto coherence and complexity, were predictive of who developed psychosis, in particular schizophrenia, among individuals at risk. These studies are wonderful. They entailed a lot of work. And the question is, can we use automated natural language processing, the tools of artificial intelligence, to understand coherence and complexity? So this is Guillermo Cecchi at IBM, who I have worked with for the past 6 years. And this is Brita Elvervag, who is really the pioneer of applying natural language processing analytics to speech and schizophrenia, having published on this as early as 2007. So one approach to looking at coherence, which Brita had used, is to use latent semantic analysis or the newer versions of this sort of word embedding approach. Is there's word2vec and glove and BERT, terms that you may have used. And I'll tell you in the next slide a little bit more about how coherence is measured, but the idea is that it indexes tangentiality, derailment, perhaps illogical thinking in language. And then in terms of syntactic complexity, there are different approaches. Guillermo has used part of speech tagging, and I'll show you a little bit about that in the slides to come, and that may index concreteness and poverty of content. Now, these are not the only approaches that can be used. I'll tell you about some others that people have used as well. I've already told you a little bit about Natalia Mota's speech graphs. But here was our approach to looking at basically using artificial intelligence and natural language processing to try to operationalize coherence and complexity. It's arguably more objective than clinical ratings and certainly more reliable. It's arguable whether using an algorithm has more or less bias than people do. It's certainly less time consuming than manual linguistic analysis. And for individuals who are doing research, who follow research domain criteria, this is for the research domain of language production, this linguistic corpus-based paradigm to study language production is what is recommended. And much of this is online and open source. So there is a natural language toolkit online. You could certainly use LSA, or latent semantic analysis, do part of speech tagging there, as well as many other NLP approaches. And as I mentioned, I worked with Guillermo and have really followed the work of Brita Elvevag, who used latent semantic analysis as early as 2007 to describe decreased coherence in individuals with schizophrenia. So for word embeddings, and I would recommend to you, Landauer writes beautifully and published T.K. Landauer in 1997. He, one of them had to do with I think a paradox or a problem that Plato encountered and thought about, which is how people seem to know much more than what you tell them, that they can make inferences. And so his approach was to think, well, we learn things, we sort of like learn what things mean, and we're exposed to different things. So we start to kind of put them together, and that's the sort of inferences that support our knowing more than what we've been told. So in terms of the acquisition of vocabulary, although when we are children, people will point things out to us, by and large, we learn vocabulary by the context in which words appear, and we start to understand that some words are sort of more similar than others. So, red and violet and yellow are colors, and apple, pear, banana, fruits, huge and tiny as sizes. Here are parts of the body. And then, if the word white came along, which group would that be in? Of course, it would be with the colors. And you can sort of assess the semantic similarity between two different words, or between any pair of words, by looking in a very, very large corpus of text at how often they occur together. So, hand and face will go together more than sort of hand and red, or, red and say like toothbrush or so. And in a 300 dimensional vector, each word in a lexicon can be assigned a 300 dimensional vector, and then semantic similarity can be estimated among words by looking at the direction that these vectors point in, and the extent to which these vectors are aligned or sort of pointing in different directions can be determined by measuring the cosine between successive vectors. So if two vectors are pointing completely in the same direction, that would be a cosine of 1. You can take word vectors and sum them and make phrase vectors. And because speech is successive and temporal, you could look at one word after another, one sentence after another, see how these sort of vectors are going. And then if somebody derails, presumably the vector direction would be very different, and then the cosine would reflect that. Complexity of part of speech tagging. Probably many of you have seen a sort of grammatical tree like this. So the cat is under the table, the is a determiner, cat is a noun, is a verb. And by doing this part of speech tagging, you can determine the complexity of speech. You can tell where sentences begin and end. And you could also look for determiner pronouns, which introduce dependent clauses. So we had a cohort in 2015 of clinical high-risk patients. We had done qualitative research studies with them, and we knew who had developed psychosis or not. So we de-identified the data, and Jill Beatty had said, do you have any transcripts that my friend at IBM could analyze? They had been working on doing natural language processing analyses in intoxication, substance intoxication. And indeed we did. And it was a very small cohort. It was only 34 individuals and 5 developed psychosis. So it was very much proof of principle. But what Guillermo found was that this LSA measure of semantic coherence, which is here, the minimum, and syntactic measures of complexity, which included how long the sentences were and the use of determinative pronouns that introduced dependent clauses. These 3 features together were able, again, proof of principle, to have 100% accuracy in classifying who would develop psychosis or not. And you see here these 5 red dots, and this is a very small study and very overfitted. These 5 individuals were outside of a convex hull. A convex hull classifier is like shrink wrapping data to make the smallest polyhedron that holds the data. So all of the clinical high-risk individuals who did not develop psychosis were inside this convex cell classifier, and the people who developed psychosis were outside. So this was only 34. Again, it's proof of principle, but we did find that in canonical correlation, it was highly correlated with the SIPS, structured interview for prodromal symptoms or psychosis risk syndrome, in particular negative symptoms with the complexity items. We also, Natalia Mota applied the machine learning classifier to a cohort of Portuguese-speaking individuals in Brazil and healthy individuals, and the classifier was able to separate them as well. And we applied it also to individuals with schizophrenia in New York. And again, we would find either the people who did not develop psychosis or the healthy controls would be inside of a convex hull, whereas those with psychosis or who were going to eventually develop psychosis were on the outside. So then Carrie Bearden very kindly de-identified and sent her data to Guillermo to analyze in the same way. This was a paper in 2018, prediction of psychosis across protocols and risk cohorts using these same LSA and part of speech tagging. And the classifier was a little bit different. It also included coherence variables. This, if you recall, yes, this was the story game, and so it was a little less structured than the qualitative research interviews that we did. And so sentence length, determinative pronouns did not come out as relevant, but the coherence variables did, as well as the use of personal pronouns, which is relevant also in other diagnoses. So this machine learning classifier was actually derived from the very data that Carrie had analyzed for her manual linguistic studies. And there was an 83% accuracy, the classifier for its own cohort, the training data set. But this was very cool. We had cross-validation. So when we took her, the machine learning classifier from her data set and applied it to the New York City cohort that we had, the 34 individuals with the 5 converters, it had 79% accuracy. So this is cross-validation, suggesting that these features really may have legs and not just be limited to, sort of one cohort or one way of soliciting speech. The classifier also, when applied to recent onset psychosis and healthy individuals at UCLA in the same clinic with the clinical or ultra high risk at UCLA Carrie's clinic, they also, the classifier was able to discriminate psychosis from healthy individuals with 72% accuracy. And so here are the different coherence variables that went into that classifier. I think I mentioned actually possessive personal pronouns. And we did a canonical correlation. This is in part to validate the automated features that we came up with here. These coherence and part of speech features were highly correlated with the manual features of illogical thinking and poverty of content. And so that sort of provides some data for validation. We constructed the same convex Hall machine learning classifiers as I had shown you in previous slides. OE here is open-ended, that's the New York City cohort, and SG was story game, that's Rochelle Kaplan's paradigm. And here are the three factors, the three main factors here, which were all coherence factors and factor analysis. And we see again sort of individuals who are not, who are clinical high risk, but not going on to develop psychosis, are all sort of within these convex halls, whereas the individuals who do go on to develop psychosis seem to have some variance from the norm. And there have been other studies using natural language processing studies and psychosis risk. These are the two I'm most familiar with. This is Phil Wolf and Negrune Rezai in 2019. They published a very nice data showing that semantic density, which is kind of like looking at complexity of speech, and latent content analysis were predictive of who in a clinical high-risk cohort developed psychosis. The latent content analysis, I believe these were based on the SIPs, showed that when people spoke about auditory and hearing and voices, that was somewhat, that had predictive power for who would develop psychosis, as did this reduction in complexity measured using NLP semantic density. And then Natalia also took her speech graph analysis and this with the group in the UK, and found that lower connectedness of speech was associated with increased risk for psychosis in individuals at clinical high risk. So these are the metrics that she used to identify the features that were predictive. So now in 2021, the state of the field is there's an expansion of NLP approaches. We looked at coherence, complexity. Now we're looking at perplexity and metaphor. You can infer symptoms. We're starting to look at dialogue alignment. You could do mixed methods with qualitative and NLP, mechanistic studies with MRI, EEG, cognition. Think about medication effects. We're looking at correlates of suicidal ideation behavior. And then of course, looking at other languages besides English and Portuguese, we have some new data looking in Mandarin. And of course, in the Netherlands, there's a lot of work being done there. So thinking about how these NLP algorithms are similar or different across diagnoses. Also very, very important to consider culture, race, ethnicity, and ethics. And I want to put in a plug. There's a group called Discourse led by Lena Palaniappan. There's a seminar series, which has been fantastic. There's an approach to archiving data together and coming up with standard approaches for collecting data. So I wanted to just put in that plug. And then just very briefly, multimodal communication is not only language, but also speech and face expression. Language is evolved in humans within a social context. There's a mirroring of language, speech, face expression. Now, everybody is using Zoom, and you can record and you can analyze. And human communication is a very complex orchestration in real time, from microseconds to seconds. Turn taking matters. There's a lot that we and others are looking in respect to not just language, but communication between two individuals, including acoustic features and also face expression. So just briefly, this is preliminary in respect to speech acoustics in clinical high risk. We have found that pause behavior is highly correlated with syntactic complexity, primarily sentence length, but also determiners. and both of them are associated with negative symptoms as measured with the SIPS. This was work by a medical student, Emma Stanislavski, and also Zarina Bilgrami. Guillermo, of course, was a part of this, and Carla Agurto did a lot of the work. Not accounted for by age, sex, or medications. So we can use these sort of NLP approaches. This was with Pratt, where we can specifically tie in negative symptoms of both sort of alogia and acoustic expression, finding that they're highly correlated. And then we've also been looking in a preliminary way at face expression. We have been recording audio-visual over Zoom with permission consent, open face for analysis with, we're looking at face action units, and we're starting to find that in schizophrenia in particular, there's a decrease in face action unit amplitude across the board, especially in action unit 7, the orbicularis oculi, which is used for social communication. We found differences between groups. We found correlates with SIPS measures of face expression. This is Stephen Heisig, who is here at Mount Sinai and has done all this terrific work with face expression. And this is Zarina Bilgrami, who we continue to collaborate with. And so you too could study language and communication in psychosis. All you need is informed consent and really a way to record. And then you have to think, what is your research question? There are the technical aspects of collecting data. A number of us have been involved in Accelerated Medicine's partnership in schizophrenia and have thought about this a great deal for the recording of and analysis of speech, language, and also face expression. You want to think about how you may diarize the speech, the separate voice streams, how will you transcribe the audio files, how to elicit language or speech, structured versus unstructured. We use qualitative research methods developed by Larry Davidson at Yale. We feel that is faithful to what Nancy Andreasen did, and it's worked pretty well in our hands. And I want to give a shout out to Zarina Bilgrami. And then this is all the people that I've worked with. I want to thank you for listening to me, and I welcome your questions and answers. Thank you.
Wow, thanks, Cheryl, for an amazing presentation and just fantastic data and a really interesting way forward in the clinical high risk or ultra high risk group. I will take the chair's privilege and ask the first question, which is, what is the correlation between these abnormalities in speech and language and cognitive symptoms?
So that's an excellent question. And just first, I want to thank everybody for signing in and listening. And I've changed my top in the intervening weeks from black to white. So in respect to language and cognition, when in the past, when language has been studied using, sort of clinical ratings, those studies suggested associations with working memory and processing speed. We have data from a collaboration I have actually with you, Allison, and Barnaby Nelson and Vermina Mizrahi, where we have collected speech on a pretty large cohort of individuals who are healthy, clinical high risk, and who have psychosis. And we find they're also in canonical correlations, not yet published, we're preparing for publication, associations with processing speed and with working memory. And, we haven't looked in respect to a sort of paradigm that looks at predictive coding. Gina Cooperberg has very nice experimental data to suggest that predictive coding may underlie some of the problems in language production and language comprehension. One way that we've thought about it is that complexity and coherence, those issues may both stem from problems. And actually, Deanna Barch had this idea to begin with almost 20 years ago. In terms of discourse planning. So when people are speaking, they're planning what they're going to say. But if it's hard to sort of keep something in mind, then when you get to the end of the sentence, you've kind of lost it, your own train of thought. And in part, that's also working memory. The options then are to say something unrelated, or maybe just to stop. And so to say something unrelated would be to be less coherent. To kind of stop would be complexity. So actually, that's more about working memory, but also this sort of idea of predictive coding. It's almost like a prediction error for what you anticipate you yourself will say. I hope that that's clear. And then processing speed, we're really very interested in, because I think it's an issue not just in terms of the production of speech by an individual, but their participation in conversations. So you saw that pauses are related to negative symptoms. And we think that pauses are probably also related to processing speed and working memory deficits as well. And this is actually really problematic for individuals, because in a conversation, it's really quite synchronized. And a long pause when someone may be thinking about what to say or processing what they've heard, that kind of slowing, is really a sort of violation. If you think about when you have conversations with individuals, if there's a long pause, and this has actually been studied, there's a whole field of research that looks at pauses and turn takings, and also conversation. When people are speaking with one another, they align in many different ways. They align in terms of what they're talking about. They align in terms of how fast they speak. If you talk to someone who, the complexity of what you talk about depends on who you're speaking with. As a clinician, you're talking with someone who's depressed, you will start to match them. The depressed individual, in terms of your acoustic prosody, will change. You will speak more slowly, et cetera. Face expression as well. And so processing speed and these cognitive deficits may interfere with that kind of synchronization, be related to pauses as well. That's a very long answer, maybe longer than it should be. Anyway.
Thanks very much, Cheryl. Excuse me, there's some questions coming in from the audience, so thanks very much, everyone, and keep them coming in. Lots of congratulations on the talk.
Oh, thanks.
Our first question says, could you please tell us more about the use of these technologies to analyze text or speech in social media apps?
So that's an excellent question. I have mostly focused on interpersonal conversations, and less so on social media applications. I think because I've been interested in conversation, but with social media apps, I mean, there is some kind of interaction. There can be. So I have many colleagues who are looking at this. John Toros is looking at this. Guillermo Cecchi has worked with Michael Birnbaum in looking at social media apps, including, say, Facebook. So people are studying it. It's something, frankly, I have less expertise in. We've been really just focused more on the dyad and interpersonal conversation.
Thank you, Cheryl. And our next question is, how does the translation of transcripts from language distant from English or West Germanic influence the NLP tools, especially given the potential utility of the tool in lower and middle income countries?
So I see this is a question by Noam. Nice. Thank you, Noam, for asking that question. And so we have a collaboration with Alexandra Koch, who is in Brazil, and that's a lower middle income country. And Natalia has also been a part of that. And this is funded actually by the Wellcome Trust. Alexandra is collecting language in Portuguese for screening for clinical high risk, and also to follow people over time. And then I think I mentioned also some recent data that we have in Mandarin, and that's in collaboration with Bill Stone. Guillermo Cecchi has done those analyses. But Noam, you're asking about translation, and so that's an excellent question. So ideally, you do the natural language processing studies in the language itself. So in respect to Mandarin, some of the features that came out, again, small study, clinical high risk versus healthy individuals, some of the features and the transcripts were translated into English and had NLP analyses in English, but also had NLP analyses in Chinese by a colleague of Guillermo's from China, bicultural, bilingual, who does NLP in Mandarin. And so many of the same features came out as similar, whether you do the translation or not, but there were Mandarin specific features that came out in relationship to location, which was very interesting, that didn't quite get captured in English. So while you can do NLP with translation, we think that's less than ideal, and optimally we encourage for NLP to be used in the language itself. So this is not available for all languages, but it's increasingly being available for most languages. And basically what you need to do NLP in any specific language is you need to have a large corpus of text that has been sort of curated and sometimes tagged and analyzed to be available for NLP analyses. So 5 years ago, that wasn't available for most languages. Now it's pretty much available for, like I said, almost all languages. I don't know, in say like terms of Africa, certainly. So I don't know Mandarin, of course, and I know in Hong Kong, people are using a corpus for Cantonese. So that's a long way of answering it, but you can do it with translation, but it's not ideal. It's best to do it in the language itself.
Thank you, Cheryl. The questions are coming in. The next question from Michelle West says, I'm curious if you have thoughts or recommendations on how these findings on speech assessment may now or eventually be integrated into clinical practice for assessment with individual clients. Many NLP approaches are labor-intensive in a way that's hard to apply in daily clinical practice.
So this is an excellent question also. So the labor-intensive aspect of NLP, I think you reviewed maybe one of my grants. This was my reply with Guillermo, is that it's sort of a initial fixed cost, right? To develop the algorithms, it's very labor-intensive. Then it's incumbent, as with any biomarker, if it looks like it has some promise, in addition to, so we did a proof of principle study, then we're doing mechanistic studies with imaging and EEG. We've done this NLP study in this very large international cohort with Australia and with Canada. And then the next steps then is, is this something that's easy to use? Is it acceptable? Is it acceptable to clinicians? Is it acceptable to individuals with lived experience, to stakeholders? Does it make economic sense? And really thinking also about sensitivity and specificity. So if you get to the point where you're using this in the clinic, you want it to actually be a useful tool that's accurate, that's not interfering with clinical practice. So I think we're not at that stage yet, but hopefully we will be.
Thank you very much. And the next question says, can you say a little more about the ages of some of the children or young people involved in the studies, and how does language sort of change and grow over time?
So that's an excellent question. And so there needs to be big normative databases, so not just individuals who have psychosis or even other sort of psychiatric diagnoses, but just normal individuals, individuals without diagnoses. And a lot of data is, we don't have a lot of data yet on children. I have a number of colleagues who are interested in doing NLP analyses in children with psychotic disorders. We have been surprised because this international study that we have which was kind of RDoC and across the kind of the language domain from healthy to clinical high risk to psychosis. Part of the task with that study has been to look at how language variables vary by sex and also by age. Sorry. And certainly there's a developmental, there's an age-related correlation with coherence and with complexity. It's not as striking as we would think. And, I think it's suggestive that Diane Gooding's study found language ratings in 10-year-olds that were predictive. So that speaks to, probably we can look in children, but I think that's an excellent question, and it's an empirical question, and the studies remain to be done.
Great, thanks. We have one more question, and you've got like 20 seconds to answer this one, Cheryl.
Okay.
So there are so many techniques. Can you tell us about your experience so far, which property or language or NLP technique has proven to be most successful in prediction of psychosis?
So we pretty much what we've done for prediction of psychosis has been in the talk, and as was Phil Wolf's study. And I think this is, again, an empirical question, and we don't know the answer. There haven't been, and then Natalia Mota also found that speech graphs, I guess, sort of complexity across the board, because Phil had semantic idea density, and we had the part of speech tagging, and Natalia has speech graphs, and all of those are related to complexity. But those are really only like 3 or 4 studies, and so we really need to know. In this international study in Australia, there's been follow-up of the clinical high-risk individuals, and that's ongoing. And so hopefully that, and also schizophrenia, will help clarify that question. Thank you. Great questions. Great job.
Thank you very much. Some fantastic questions coming in. I guess another outcome of interest, which we might be able to predict with these techniques, is actually functioning rather than actually transition to psychosis. And that's for a later talk. Anyway, our time is up. Thank you so much, Cheryl, for a fascinating talk. We've had loads of people listening live. I'm sure we'll have loads of people listening to you on the recorded version of this. So thank you, everybody, for having some fantastic questions coming in. And it's time for you to have a break now and then find your next live session. Bye.